Hello everyone, welcome to another video. In today's video we'll be looking at hepatitis C. Hepatitis basically has I think it has like five types. There's hepatitis A, there's hepatitis B, there's hepatitis C, and there's hepatitis D and E. Today we'll be looking at hepatitis C. So the good news is that hepatitis C can now be cured in most people using oral medicines called direct acting antiviral drugs. So these medicines, they are taken once daily, usually for 8 to 12 weeks, and they have very few side effects, and they can remove the virus completely from the body. They come as tablets and they are taken by mouth, and most people are cured after the treatment. So for an example of these viral drugs, we have sofosbuvir and velpatasvir with the brand name Epclusa. So this drug is taken as one tablet daily by the mouth for 12 weeks, and it comes in 400 milligrams, 100 milligrams. And who can take this drug? This drug can be taken by people with any type of hepatitis C, whether they have liver damage or not. That is, like, as long as the liver damage is not severe, they can take these drugs, and it works for all types of hepatitis C. So there's no need for testing on which type you have to use for this particular patient. So there are also many other different types, but the important thing to note when giving these drugs for treatment, first you have to confirm the person has an active hepatitis C by telling the person to do a blood test and that checks for the virus itself. Then also tell the patient to go for a liver function test to check how well the liver is doing and the extent of damage, and also checking the kidney function, because some of these medicines, they are not safe for people that have like ongoing kidney problems, because the kidney plays an important role in like clearing out in drug clearance basically. So we also have to check for other infections, like if the patient has hepatitis B or hepatitis or HIV virus, and then check for other medicines the patient is taking to make sure there are no dangerous drug interactions. And during and after treatment, there is usually no special monitoring that is needed during the 8 to 12 weeks when the patient is taking these drugs, unless the person has health problems. Then after finishing the treatment, the person should do another test after the 12 weeks to check if the virus is gone. And if the virus is gone, that means the person is cured. And once the person is cured, the liver can start to heal. So the liver is a very powerful organ, so it can heal. It can start to heal by itself, and this is usually possible if the damage wasn't too advanced. So usually, if treatment is not taken early, cirrhosis can develop, and cirrhosis is like permanent damage of the liver. So the liver can become permanently damaged. The person may even need a liver transplant, and then the risk of having liver cancer can potentially becomes high. So for prevention, there is no vaccine for hepatitis C yet. So prevention focuses on avoiding contact with the infected blood and ways to prevent it. So number one, do not share needles or any sharp items with anybody, and also make sure medical procedures use sterile equipment, and also try to avoid tattoos or piercings in unsafe settings. Like these days, people just pierce their body anyhow and pierce their body anywhere. So try to like avoiding all these kind of things. Just It's just better for us, better for our health. And also practicing safe sex too, especially if there's a chance of like blood interaction. And also personal items like razor, toothbrushes, it's better not to share them. I don't even know why anybody will be sharing toothbrush. I can understand razor to an extent, but toothbrush, it's just nasty. I don't even know how to put it. It's just very nasty. Then if you know you're at risk of getting this hepatitis C virus, like you've seen maybe your pattern of lifestyle, you're someone that gets tattoos all the time, you're someone that shares needles and all those things, it's good to get tested regularly if you're at high risk. So in summary, basically, hepatitis C is a disease caused by hepatitis C virus that causes inflammation of the liver and is spread by infected blood. The particular organ affected is the liver, and the symptoms, they don't appear in the beginning stage. They only appear in the later stages when the liver has been significantly damaged. So the transmission, blood to blood contact, the by transfusions or through needles, then diagnosis, blood tests for antibodies and the virus, treatment, oral antiviral drugs for 8 to 12 weeks of therapy, and usually the patient is cured after the therapy. Prevention, there's no vaccine, and it's better to avoid contact with the infected blood. So the thing is that when it comes to all these infections, it's good for the patient to have patient education. So it's good for healthcare professionals to try to educate the patient on like the ways of transmission and how they can get the infection. So like I said at the beginning, I was going to talk about the difference between the hepatitis C and the other 4 forms of hepatitis. So when it comes to hepatitis A is spread through dirty food or water, and it goes away on its own. So it does not cause long-term damage, and there's actually a vaccine for hepatitis A. For hepatitis B, it's spread through blood and sex, and it can become long-term, but is preventable with a vaccine too. Then hepatitis D, it only happens in people who already have hepatitis B, so they go hand in hand, and it makes hepatitis B worse. Then hepatitis E spreads through dirty water or uncooked meats, and it is usually short term, and it is dangerous, especially in pregnant women. So in summary, hepatitis A spread by dirty food or water, which is also similar to hepatitis E. So hepatitis A and E have the same way they are spread. And hepatitis A is not chronic. There's a vaccine for hepatitis A, and is usually a short-term illness and with no long-term damage. The hepatitis B spread through blood, sex, and childbirth. It can be chronic, and there's a vaccine for hepatitis B, and is also preventable. Then hepatitis C through blood contact. It's through blood contact. It's chronic. There's no vaccine. Hepatitis D needs hepatitis B to happen before it can occur, so it makes hepatitis B worse. And yes, it's chronic. There's no vaccine for hepatitis D, and it only exists with hepatitis B. It cannot exist alone. The hepatitis E, similar to hepatitis A, transmitted through dirty water and food. It's not chronic. It rarely doesn't have vaccine. I don't think it has a vaccine. And hepatitis E is particularly risky in pregnancy. It's very dangerous in pregnancy. So yeah, that is the summary of hepatitis C and his brothers and sisters. So I'll see you in the next video. Thank you for watching. Bye.